Devolution Manchester, well, I suppose this is the Northern Powerhouse project that the government have embarked upon, and very much around in Greater Manchester, the 10 local authorities being given devolved powers and control of budgets, and this extends in this particular case to the whole health and social care budget, which amounts to £6 billion. So they'll control it all. Now, in essence, what this does and why we need to be involved really is that it really encompasses everything, whether it be education and worklessness that the local authorities deal with, social care, or NHS services delivered by CCG or primary care services. So primary care services are in the mix, and you know all budgets are devolved locally. And so what we need to do is keep eye health on the agenda and take the opportunity to see if we can get scalability at a Greater Manchester level and more services commissioned with streamlined pathways, and maximising the opportunity that optometrists can add value. It's a completely new territory for us in England. We really need to watch this space carefully, and we've been working very hard with the LEHN, the LOCs, with LOCSU support to making sure eye health remains on this agenda. There's a couple of opportunities and we're exploring every avenue that we possibly can, and I think what we really want to do is be able to influence commissioners in the area to actually say, well, do you know what, we should be using community optometry at the heart of this delivery, and actually there's no reason for a postcode lottery across Greater Manchester, and we would ideally like them to commission this at a Greater Manchester level, potentially breaking down some of those barriers around IT, infrastructure and communications. Greater Manchester is a population of 2.9 million people. We've got 324 optical practices in that area, 12 CCGs, 12 trusts, in total 37 statutory bodies. It's that big, and that doesn't include all the providers either. And obviously now it's extending to other parts of the country, maybe at an earlier stage, Liverpool, Sheffield, etc. So we really need to be looking at what the opportunities are and capturing those. Now our ask is for services commissioned at a Greater Manchester level with IT infrastructure and communication inbuilt, us integrated with primary care. So as far as vision to the future of access to GP records to enable us to be involved in wider public health. So I think the key here is that it's a great opportunity to see what we can do at scale, to extend what we're doing and include, and see if we can break down some of those barriers. There's ongoing work. You know, we've been working with CCGs since their inception and convincing them of the case, and in some places we've been very successful. In large parts of Greater Manchester we have a good track record, but there are parts where we don't, and I think work will continue in increasing the amount of community services delivered.